The cervical screening test, sometimes called the smear test, now looks for the human papillomavirus, or HPV for short. This is more accurate than the previous test that only looked for cell changes in the cervix. What is HPV? HPV is a very common virus which 4 out of 5 of us will get at some point in our lives. Most of the time it's cleared by the body itself, but around 1 in 10 infections are harder to get rid of. HPV is passed on through any type of sexual contact such as touching, not just penetrative sex. Condoms don't give complete protection from HPV. There's no way to know when you first got HPV or who you got it from. You can have it for years without even knowing. Why does the cervical screening test now test for HPV? Certain types of HPV, also known as high-risk HPV, can sometimes lead to changes to the cells in the cervix. Over many years, if left untreated, these changes could lead to cervical cancer. Nearly all cervical cancers are caused by HPV, which is why we now test for it as part of cervical screening. If we find HPV, we'll then check to see if it has caused cell changes. Testing for HPV before looking for cell changes is a more effective way of identifying those at risk of developing cervical cancer. It will help ensure most cell changes are found and treated earlier. The HPV test will be carried out by collecting a sample of cells from your cervix in the same way as the previous test, so the cervical screening test itself has not changed. For more information about cervical screening in Scotland, visit www.nhsinform.scot/cervical screening or call 0800 22 44 88.